What if the one food your doctor told you to eliminate is the same food that peer-reviewed clinical research shows can improve the very mechanism at the center of your disease? Every week I hear the same sentence from patients sitting across from me. I cut out everything: bread, rice, fruit. I even stopped eating chocolate. And every time I hear it, I ask one question: which chocolate? Because that question changes whether chocolate is slowly harming you or actively working in your favor. There is a form of chocolate with a documented glycemic index of 23, lower than most vegetables and lower than a serving of oats. Clinical trials in people with type 2 diabetes have shown measurable reductions in fasting blood glucose, HbA1c, and inflammatory proteins linked to insulin resistance. Excited that food is sitting on the shelf of your local grocery store right now. The problem is that most people either avoid chocolate completely and lose a clinically supported metabolic tool, or they eat the wrong type and confirm every fear they already had about their blood sugar. My name is Dr. Matau Jamie. I am a preventive medicine physician and longevity researcher with more than 20 years of clinical experience focused on metabolic disease, type 2 diabetes, pre-diabetes, and chronic inflammatory conditions. Today, I'm going to show you 5 specific forms of chocolate that scientific research supports for people managing blood sugar. I'll explain how they affect glucose metabolism, what the studies actually found, the correct amount supported by evidence, and the label traps most consumers completely miss. Before we get to the 5 forms, you need to understand what makes cacao different from every other sweet food. Cacao contains extremely high levels of compounds called flavonols, especially epicatechin and catechin. These compounds improve endothelial insulin signaling, reduce oxidative stress, and may even support pancreatic beta cell regeneration. Insulin resistance is basically a communication problem. Insulin is present, glucose is present, but the cells stop responding properly. Flavonols help restore that signaling pathway. They also reduce oxidative damage caused by chronic high blood sugar, protecting insulin receptors and glucose transport systems inside the body. And early research suggests epicatechin may help support the cells responsible for producing insulin itself. But here's the important part. These benefits exist in real cacao, not in sugary milk chocolate bars loaded with sugar, artificial flavoring, and processed fats. The first form is dark chocolate with at least 70% cacao. This is the easiest starting point for most people with type 2 diabetes. At 70% cacao, the glycemic index is around 23, which is considered very low. It contains far less sugar than regular chocolate and more cacao fat and fiber, which slow glucose absorption. Research from the Harvard T.H. Chan School of Public Health and a meta-analysis in the British Journal of Nutrition found that flavonoid-rich dark chocolate improved insulin sensitivity and reduced fasting blood glucose. The ideal amount is about 20 to 30 grams daily, roughly 2 to 3 squares, preferably after a protein and fiber-rich meal. But here's the trap. Many products marketed as 70% dark chocolate still list sugar as the first ingredient. Real dark chocolate should list cacao mass or cocoa mass first, not sugar. The second form is dark chocolate with 85% cacao or higher. This is where the flavonol concentration becomes significantly stronger, while the sugar content drops even further. A randomized, controlled trial involving patients with type 2 diabetes and hypertension found that consuming 25 grams daily of high flavonol dark chocolate for 8 weeks significantly reduced inflammatory markers like CRP, interleukin-6, and TNF-alpha, proteins directly linked to worsening insulin resistance. The practical dose is 20 to 25 grams per day, and because the flavor is more intense and less sweet, most people naturally eat smaller portions. The trap here is packaging terms like extra dark or intense. Those words mean nothing unless the exact cacao percentage is clearly printed on the label. The third form is 100% cacao chocolate and raw cacao nibs. These are the safest options from a blood sugar perspective because they contain zero added sugar. The glycemic index is essentially zero. They are bitter at first, but most people adjust after a few days. Cacao nibs also contain very high amounts of fiber, which helps flatten post-meal glucose spikes. One practical option is mixing melted 100% cacao with natural almond butter. Another is adding cacao nibs to unsweetened Greek yogurt with a little stevia. These combinations deliver flavonols, protein, and fiber together, but be careful with labels. Unsweetened baking chocolate is fine. Bittersweet baking chocolate usually contains added sugar. The fourth form is sugar-free chocolate sweetened with erythritol or stevia. This option is especially useful for people who struggle with the bitterness of higher cacao chocolate but still want minimal blood sugar impact. Erythritol has a glycemic index close to zero and does not significantly raise blood glucose or insulin levels. Stevia works similarly because the compounds responsible for sweetness are not metabolized into glucose. The serving size remains around 20 to 25 grams daily. But there's a major trap here. Many so-called sugar-free chocolates use maltitol instead of erythritol or stevia. Maltitol has a glycemic index of around 52, high enough to noticeably raise blood sugar. Always check the sweetener list carefully. The fifth and most powerful form is pure unsweetened cacao powder. This has the highest flavonol concentration per gram because it undergoes less processing than solid chocolate. A systematic review published in the journal Nutrients analyzed 7 randomized controlled trials in people with type 2 diabetes and found that cacao powder and dark chocolate improved fasting blood glucose, post-meal glucose response, HbA1c, HDL cholesterol, and LDL oxidation. The practical dose is 1 to 2 tablespoons daily. You can mix it into black coffee, Greek yogurt, almond milk, or oatmeal. The ingredient list should contain exactly one item: pure cacao powder or pure cocoa powder. Avoid flavored mixes or instant hot chocolate powders because they usually contain sugar and additives that destroy the metabolic benefits. There's one more thing that almost never gets discussed in conversations about diabetes and food: the psychology of restriction. Research shows that people who feel guilt after eating certain foods are more likely to overeat later. Restriction creates a cycle: restriction, craving, guilt, overeating, then worse blood sugar control over time. But someone who understands that 2 squares of 85% dark chocolate after dinner can actually support insulin function has a completely different relationship with food. That knowledge changes behavior. And behavior, repeated over months and years, changes outcomes. So here's the complete summary. 70% dark chocolate is the best starting point with a low glycemic index and good flavonol content. 85% dark chocolate provides even more flavonols and less sugar, with strong clinical evidence for reducing inflammation. 100% cacao and cacao nibs offer maximum flavonol concentration with zero added sugar. Sugar-free chocolate sweetened with erythritol or stevia gives you familiar flavor with minimal blood sugar impact, but avoid maltitol. And pure, unsweetened cacao powder provides the strongest scientific evidence for improving blood sugar markers and HbA1c. Chocolate is not forbidden for people with type 2 diabetes. The wrong chocolate is. And now you know exactly which forms are right, how much to consume, and what to look for on the label, so marketing claims can never mislead you again. I'm Dr. Kenji Sato. If this helped you replace confusion with clarity, share this with someone managing diabetes who believes they can never enjoy chocolate again.